Bright Ideas for Your Business with Amy Blain, the show that takes you around the world to share interviews with some of the most successful and relevant people on the planet. Hear their stories and get the most important business lessons they have learned on their road to success and get exclusive advice on how to implement their success into your life and business. Bright Ideas for Your Business with Amy Blain is brought to you by the Strategic Advisor Board and your host, Amy Blain.
This is Amy Blain with Bright Ideas for Your Business podcast. This is our inaugural podcast, and I am happy to welcome Itamar Shafir from Umbrella Healthcare as my first guest. Welcome, Itamar.
Thank you for having me, Amy. Super excited to be here.
Well, let's go ahead and dive in. I'm very excited about this new offering that Umbrella has. It's relatively new, the last couple of months. Is that correct?
Correct.
And if you could maybe just go into a broad description of what exactly Umbrella Healthcare is and why you feel it's important for business owners to know about.
Right. So Umbrella Care actually comes and helps with attracting and retaining employees to a market which is either heavily dependent on 1099ers or doesn't have, or the people that work in that market don't have full coverage. The business cannot offer them full coverage. So let's take as an example, you're a small business owner and your employees do not have, your employees or your 1099ers don't have full coverage, and you want to give them health benefits so they can stay with you, and you also want to attract better employees. And with our wellness programs, which we can go over today, we basically can offer a very robust healthcare program for starting at $30 a month per family, which is considered very, very low for the type of services that we offer. And includes, unlimited telemedicine. It includes visits to the doctor. It includes MRIs, CTs for the same price. Absolutely phenomenal programs. So now every business can take care of their employees and their 1099ers, which they can't with regular insurance, and attract and retain better employees, better workers.
Yeah, in this market right about now, that is really important because that can give an employer a leg up as far as finding high quality employees to give them that benefit.
Yeah, 100%. And not just now, whether we think one of the examples that I like to give, but it's relevant for a lot of businesses. For example, in the coffee shop industry, okay, it's very student-based work, a lot of young people, and there is a huge churn because what happens when they reach the age of 26 and they're no longer under their parents' coverage, they just leave to a job that does offer coverage. And now we have a lot of clients in that industry that can now offer all these 26-year-old employees great healthcare benefits, and they can afford to give them those benefits. Another plus of our program is you can actually decide how much you want to take on and how much you want to have the employee or the worker pay. So for example, let's say from the $30 I mentioned before, employer can cover $15, worker can cover $15, just as an example. In the real estate niche, right? Almost all realtors are 1099ers and they have teams. And sometimes you have real estate teams of 50, 60, sometimes 200 people.
Wow.
And the heads of those real estate teams, they want to keep and attract all those great realtors but they couldn't until now. They're very limited on the healthcare benefits they can offer. And now they can offer amazing healthcare benefits. And the list goes on and on. Even Umbrella, right? In our team, we have a lot of 1099ers, especially on the sales team. And also for businesses that may employ low-cost employees or have low revenue or very small and don't have the funds to offer full coverage for their employees.
Absorbently expensive to be able to do traditional health insurance for employees.
Insane.
Yeah.
It's in the, 400 plus a month.
At least, yeah. Especially if it's for a family.
Right. And with these benefits, almost any employer, any company can afford to either cover, and if they don't want to cover any worker almost can afford to pay themselves for these plans that they didn't have access before.
And again, that gives that employer a heads up, or be ahead of their competition as far as being engaging these new employees to get them on board that their competition may not be able to offer because they don't know
100%.
about it. Yeah.
100%. And I think there isn't a person, I understand this podcast it has a lot of small business owner listeners. And I think any small business owner that ever tried to hire somebody is always in a disadvantage, right? The question comes up, benefits, do you offer them? Sorry, we don't. And that's, that costs you something when it comes to hiring. And now it's a big pain that you can solve, and obviously take care of your people, which is another important thing to do.
Sure, because you want your employees to be healthy and productive and feel like they matter to you, that you want them to have this benefit. And
I think for a lot of employers, they do matter. A lot of employers, I think, feel bad that they can't do more when something happens, and now everybody can.
Yeah, great. Now, is this just for the US?
Right now it is. Yes.
Okay. And I know that you initially talked about the $30 a month plan, and I know there are also plans that have more benefits available. Can you maybe describe those and give us a little high level view of what all that, all the benefits of those?
Sure. You know what I'll do? I think the easiest way is, since this is a video podcast, and maybe I can share my screen and take you through a few examples of the actual programs.
Sure.
So right now we have 4 types of programs. In January, February, we're launching 4 more that are even more encompassing. But let's start with Advantage Wellness, which is the basic program. Kind of have a high level view of what it offers. A few things that I really like as a parent, as well as actually mainly as a parent, is the telemedicine service. We have 12 specialties for doctors. It could be a skin doctor, pediatrician, that you have access with zero cost, 24/7 to any doctor, 10-minute average wait time. You call, my kid has a rash, I have an issue. I can give you a lot of examples of people that second guess, didn't want to go to the ER, didn't want to go to their doctor. And they actually went on a call with our telemedicine service, and they saved their lives because they understood what to do. And they said, okay, you need to go now to the hospital. And it goes the other way around as well, right? Sometimes you get really anxious about something, and then you talk to the doctor, and it's not a big deal. So telemedicine, as much as you want, call the doctor every day, as much as you want. Dental discounts. So just as an example, adult cleaning starts $46. Pediatric cleaning starts $36. No restrictions, no limits, meaning, you're not limited to how many visits you can do a year. Not limited to in any situation, not just on cleaning. So if your kid or yourself have, or a member of your family have a lot of dental issues, then it doesn't cost you more. The policy doesn't cost you more. You don't have limitations. You go as much as you want. And 262,000 location nationwide. So anywhere you want to go, we'll take care of you. Vision, same way, with great discounts on eye exams, prescription eyewear, contacts, LASIK. A lot of people are doing LASIK surgery today to walk around without glasses. So 30% discount on that, and tens of thousands of locations as well. Pharmaceuticals, that's a big thing. Save up to 85% on pharmaceuticals. We have all the major pharmacies participating, CVS, Safeway, Walgreens. Just as an example, just want to give you a few examples of known medicine that you can save on. Lipitor, instead of $218 retail, it's $420.
Wow.
Zoloft, instead of $32, $691. Okay, these are drugs that, unfortunately, Xanax, you can see here below, instead of $32, $660. It adds up. Hopefully you're not taking any medicine, but if you are, this can save you a ton of money.
Yeah.
And obviously preventive services, lab testing, diabetic supply, MRI, CTs, a ton of great services. A program like this would usually cost you something $4,000 a year. And all this, it costs just $30. And not just $30, it's $30 per family.
Wow.
Meaning, if I want to enter, so I have a family of 4. My wife, I have 2 kids. It's not 30 times 4. $30, and they're all covered under this program. They can all use it.
Amazing.
Right? It's unbelievable. Now, the second program that we have is an expansion of what you just saw. It's Advantage Wellness Plus, and it's everything you saw, but with with a few very important things that I think are critical. So priority primary care, meaning it's in-person primary care. Sometimes telemedicine is not enough. Sometimes there are issues you really need to visit the doctor. You need them to examine you, to see you. It's just $10 a visit.
Wow.
A limited visit. So let's say you even go once a month. It's $10 a month for an actual physical visit to the doctor with a full examination, and it includes the lab tests. So that's insane. Then you have unlimited urgent care, which I think is critical. Again, I'm thinking from a parent's perspective, but also from my parents as well. Urgent care is critical. Things happen. You don't know when they're going to happen. God forbid, break a leg, fall down the stairs. Who knows what happens? You need to go to urgent care. It happens all the time to all of us. And it's in-person urgent care visits, unlimited visits just for $25. Meaning instead of reaching that hospital, and getting, a bill for $5,000 when you get out or more, it's $25 and you're completely covered, including all the tests like x-rays included, MRI included, scans included in that $25 fee. And you pay just the $25 when you need to. You don't pay it in advance. So these are 2 things that I think, for me at least, when I'm looking at what I need for my family, I love those things. I think they're very important. Chronic disease management. For a lot of people, unfortunately, many chronic diseases, we handle 13 types. So you can schedule an appointment within 24 to 48 hours. Limited visits, $10 a visit as well. It includes anxiety, arthritis, asthma, blood pressure, CHF, COPD, depression, diabetes. These are unfortunately issues that so many people are suffering from, and you need chronic disease management. You need to see your doctor sometimes on a weekly basis, sometimes on a bi-weekly basis. They need to check you up. They need to go over with you about your medicine that you're taking, and that's part of what we provide. And it's just $10 a visit. It includes meetings with relevant doctors. And one of the things that I love the most is concierge care services. Concierge care services means I have a number and an app that are on 24/7. I call the number and they book me whatever I need.
Wow.
I think it's also excellent for, right?
That's something you usually see.
Right. And I think also for, for elderly people, maybe it's, I know, my parents, for example, would be much easier for them to just have one number to call for everything that they need, than go on a website and start, sifting through a bunch of information, trying to find what they need.
Yeah, for sure.
And this program is $99.
Wow, that's still really
right.
I mean, I remember trying to get coverage for my husband and myself, and we didn't have any real pre-existing conditions. And this was on the health marketplace because we're both entrepreneurs. And it was going to be $1,600 a month just for the monthly fee. It was crazy.
Insane. That's insane. Yeah, I know. And this changes everything.
It sure does.
Yeah, and I know some people are asking, because I got that question a lot, what about hospitalization? So right now we don't have hospitalization covered under these programs, but we do have 4 programs coming out in, I would say, either Jan or February 2023. And those are going to include that as well for the same prices. Okay.
Wow.
So be ready for that.
Yeah, for sure.
This is our third package. Yeah. You have anything to say, Amy?
No, go ahead.
Yeah. This is our third package. It's focused on mental health. So, for example, if you need a virtual therapist, if you need to see somebody to help you with coping with whatever it is, you can have unlimited visits available 7 days a week, and you get matched your personal therapist, and you can confirm an appointment within 3 days. So,
Wow,
for
that's
those of you,
amazing.
right,
That's
how much is
something
it
that
usually to get a session with a therapist?
weeks and weeks, if not months and months, and just the fact that it's included at zero cost. I mean, that's huge. I know a lot of traditional insurance plans don't include mental health
Yeah,
at all,
and
period.
they don't include. And if you want to go privately, it's hundreds of dollars per session.
If you can get in.
Uh, if you can get in, right? Yeah, and on-demand counseling, and alternative medicine as well, which I think is huge. Obviously, same
Yes.
types of pharmaceutical discount. But what I focus here is the alternative medicine and the virtual therapist. For me, that's like the big thing that would cost, $700 a month in regular insurance. And here it's just $99
Wow.
a month.
Now,
Last
is that
plan that
above and
we
beyond the other program then? Or is that
so no, that's beyond. That's a
separate?
special program.
Okay.
But what happens if you want to bundle several programs together, we give you a very high discount. So
Okay.
if you come and say, look, I want both the mental health and I also want the Advantage Wellness with the urgent care and everything else and all those things. It's not going to be 99 plus 99. It's probably going to be less than $150.
Oh,
So we're actually, even those encompassing plans, we're trying to make them as easy on the pocket as possible. And I remind also the employers listening, we start from $30 per family. So if you want to, you can always say to your employees or workers, hey, I'm covering this, or I'm covering most of this, the $30. And it's going to give you a wide range of options. But hey, if you also feel that you need this specifically, talk with these guys. Are going to give you a discount because you're working with us. And we provide each employer with their own enrollment website.
oh, that's
So
nice.
they can, right? So they can send an email and let everybody know. You can go in, see all the different programs with a discount that we got especially for our company, and book a conversation with an expert team. Have a conversation about your issues, about your expectations from the program, about what you need, and you'll talk with experts in our team that will suggest the right package for you and build the right price for you as well.
That's that this is all, it seems like it can't be possible. I think a lot of people might say, oh, right, yeah, this is not legit. How can it possibly be? You
So
run up,
it's
you have that issue sometimes with the people that you talk with about this?
yes, a little bit. The first response is sometimes unbelievable. I don't believe it. So I say, let's get into the nitty gritty of it. Let me show you, and let me also take you. And we have a vendor map that you can say, okay, I'm living in this and this zip code. Show me what I have in my area. And we actually click on the map and we show them, oh, we have this dentist, we have this therapist for you, we have this and this and this. And you can actually go and check them out. Like you can go online, check out if they're a good therapist, if they're a good doctor,
Like their reviews, that type of thing?
exactly. You can check them out themselves. How is it possible? The reason it's possible is there is a big difference between, there are several reasons why it's possible. In regular insurance, you have a bank of money that is committed to you. So you're paying every month to save, to get a coverage that is worth a specific amount of money.
Okay.
Okay. This doesn't happen. And for that service, basically, there is an actuary, right? So it says, okay, if I need to cover Amy for $1 million, and I know Amy at her age with her, physical condition is in this and this risk. So I need to charge Amy this amount because I need to cover myself and make some profit.
Right.
In healthcare benefits programs, we don't go into that realm. We don't say, hey, we're covering Amy for $1 million. We're saying we're providing Amy with healthcare services for an agreed upon price. Okay.
Mhm.
So that changes the entire scale of economics when you don't have to make that commitment. In addition, we're also working at very, very large scales. Okay. So we basically, as a subscription company, we try to get to millions of people. Obviously, this is new, only has a few tens of thousands of people that have started signing up for it, but it's growing very, very fast. And that commitment
Understandably.
of scale, what?
Understandably, if it's, such a
Yeah,
great opportunity.
it is a great opportunity, and so many people need it. And I think also the market is becoming more 1099 oriented. You see
For sure.
more, right?
It's the gig economy.
It's the gig economy, and also even in like mainstream companies work more and more with freelancers.
Well, I think
It's
COVID kind of changed the whole business proposition. Everything changed when they were forced to, basically.
indeed, and I think it started earlier with high tech maybe, and it's expanded rapidly to other realms. But today, I think what we used to be the employer-employee model kind of shifted a little bit into the employer, the partner model, meaning the company that is ordering and the provider, but they don't have to have an employer-employee relationship. And once you're not a W-2, first off, you're out of the coverage. Like you're, for some reason, you're absolutely out. But you still see companies hiring and keeping, even if it's not regulatory allowed in their state, but you still see that relationship going on for years. You have companies working with the same freelancer for years on end. They want to keep him. They don't want to lose him. And also when it comes obviously to W-2 employees, you don't want to lose them as well. Your core team, if you can't afford to give them coverage, you need to do something about it. And this is something that you can do.
Yeah, this is a brave new world, but it sounds like a great response to the situation. I had another couple of questions. There's no like enrollment period for this, like there is with the health market, for example, or other, again, traditional insurance situations. Is that correct?
It's usually a 30-day buffer, but no more. Meaning from the time that you want to join, you might need to wait up to 30 days to
I
get
meant as
on
far
the
as
monthly
enrolling, you
enrollment.
don't have to wait until
Yeah.
January to enroll for
No,
a new program
no,
or be a new employee necessarily.
not at all.
Okay,
You don't
cool.
even there aren't even any barriers to existing conditions.
Well, that was going to be one of my next questions because I know that's a biggie. Because
I
a lot of
agree
people, have existing conditions, and that's again been an issue with traditional healthcare, from the get-go.
completely. And and people ask, a bunch of people who understand insurance ask me as well, how come? Like, how can that be? How come your company is taking such a risk, actuary risk? So I said again, we're not taking actuary risk. It's a matter of scale and subscription for services. We don't cover a person's, well, in these programs, we don't cover a person's, God forbid, hospitalization for 6 months because they can't work and they need to get, I don't know, chemo or something. That is indeed extremely expensive. And it's not a risk we take on ourselves. We're saying for most people, for 99% of your day-to-day existence, these are the medical services you need. For the catastrophic situation that might happen to you in the future, for that right now, you do need regular insurance. We are coming up with new programs early next year that would even cover hospitalization.
Okay. Well, speaking to that, say people have regular insurance, but they have a really, really high deductible and it is very limited. Can you do both programs at the same time?
Definitely. A lot of the people who join our 30 box program are people who are also on the Obamacare and on the Medicare, and it goes well together, exactly for the reason you just said.
So this can be paired with Medicare too, then, huh?
Yes, 100%.
Interesting. So I know that we're in the enrollment period for that right now for the third party Medicare supplement people. And obviously there must be a lot of people that need that, because I've seen a lot of commercials about it on TV, and we've been getting a lot of direct mail and that type of thing. My husband is about ready to turn 65, so he's on that list. So,
definitely.
okay. Well, are there any other things that you would like to highlight here?
No, I think maybe just mentioning, Amy, where they should register if they're interested in more information.
Sure. Let me, I have a website. It is on the screen right now, and it is at getaffordablehealthbenefits.com. You can see a lot of the information that Itamar just covered, not all of it, but the highlights. And then in order to get enrolled, basically you click on the request to get a call to learn more information, fill out that brief form, and then you will be contacted to be able to discuss any questions beyond, for your specific situation, and get yourself set up and kind of go from there. There's no cost for that. There's no commitment. Correct, Itamar?
No commitment, no cost. Just talk to an expert and see if they can find you the bundle that you need. Okay.
And again, this is, as you have mentioned, relatively brand spanking new for the concept. It's just a totally different mind shift from traditional insurance. But again, it's a brave new world now since COVID. So, I'm sure that is part of why this was developed, because of the changes in the business world in general, and how people are employed, or how they're more likely to be freelancers. And again, I think the biggest takeaway is that this is a great opportunity for smaller businesses who really just can't afford to offer their employees traditional insurance, an opportunity to give them some great coverage for a very, very affordable amount of, monthly fee.
Completely. 100%. It's
and I'm excited to see the new other additional options that are coming down the pike in 2023, which is just around the corner. So
yeah, invite me again.
I will. That's a great idea when that's all in place, so we can get more details. Okay.
Perfect.
Well, wonderful. Well, thank you for being my inaugural guest on the Bright Ideas Business for Your Business podcast. And look forward to hearing more from you in the future about the updated products that are going to be available.
Awesome. Thank you for having me, Amy. I really appreciate it. It's been wonderful, and I'll keep you posted.
Okay. That sounds great.
Thanks for listening to Bright Ideas for Your Business with host Amy Blain. Please leave your feedback and visit strategicadvisorboard.com to get the latest and greatest business advisement on the planet. Follow us on social media for updates, and we'll see you on the next episode.